Welcome back, everybody. We're going to begin our second session now of the HAI conference on COVID-19 and artificial intelligence. My name is Rob Reich, and along with Russ Altman, we're co-hosts for the conference today. Our first session was a basic landscape and framing to set up a wide-ranging discussion throughout the rest of the day. And this second session is going to focus on the social impacts of COVID-19, as well as broader issues of biosecurity. One of the things that marks the approach of the Institute for Human-Centered Artificial Intelligence is that it's not just an effort of AI scientists to push the frontier of AI forward, but a fully interdisciplinary approach so that the ethical and social and economic and psychological impacts and orientation to thinking about artificial intelligence are always and everywhere present. And that's very much the approach we're going to take in this second session. So we will focus, of course, on COVID-19, but we'll be having a discussion with a great panel of experts about some of the social impacts of the coronavirus and the pandemic that we now confront, as well as broader issues of biosecurity and the challenge that the globe faces in making a more secure future, secure from the kind of ravages we see right now from the pandemic. So I'd like to welcome our first speaker. Our first speaker is Kate Starbird. She's a professor at the University of Washington, and she's going to talk to us about the idea of a COVID-19 infodemic as well as an epidemic or pandemic. Kate, you're welcome to share your screen now with us and start.
All right. I am actually not going to use slides this time around. My talk today is a reflection on COVID-19 from the perspective of a researcher of crisis informatics. For over a decade, my colleagues and I have been studying how people converge online during crisis events. Our field is informed by much older research in fields of sociology of disaster and the psychology of rumor, and many of our lessons are relevant to COVID-19. I'm going to start with what we know about human responses to crises generally. So crisis events as they unfold are often characterized by high uncertainty about what's happening and what we should do about it, both individually and collectively. In these cases, the facts of the situation are often dynamic and there are often unknowns or things that need to be resolved. This uncertainty feeds anxiety about the personal and collective impacts of the event, as well about what actions we should take. What should we do? Where should we go? When should we evacuate, or in this case, quarantine? Under these conditions, people come together to seek, process, and share information to try to resolve that uncertainty and anxiety. It's a part of the human response to disaster events. Researchers call this process collective sense-making, and it's been theorized to serve both psychological as well as informational needs. Though a natural response to crisis events, sense-making can produce rumors, including ones that turn out to be true and ones that turn out to be false. And as we know, false rumors or misinformation are dangerous because they can cause people to take actions that endanger themselves or others. Historically, the biggest challenge for people experiencing a crisis event was an absence of official or good information. And in that void, people would share information with their families, friends, and neighbors to try to make the best decisions. In the connected era, the problem isn't necessarily a lack of information, but the overabundance of information and the challenge of differentiating between information we should trust and information that we shouldn't trust. And unfortunately, our current information space is characterized by the pervasive spread of mis and disinformation and the active politicization of just about everything. The conditions of crisis make us particularly vulnerable to these types of messages. So with COVID-19, we have a perfect storm of sorts. The event itself is highly uncertain, with the best knowledge and the underlying science changing from day to day as we learn more. And the uncertainty is very slow to resolve as the event continues to affect people all over the world. As a result, we're all experiencing this extended period of anxiety where we're trying to resolve it by searching and searching and searching for more information. And we're doing that in an era where our information systems are already inundated with rumor, misinformation, and disinformation. And so within this sort of perfect storm, what kinds of actions should we take? What should we do? And I mean we in a lot of different ways. So when I think about we as information participants, I would recommend that we tune in to how our anxiety fuels the sort of information seeking and sharing practices that may make us susceptible to spreading misinformation. Perhaps this is the hand washing for the infodemic part of the pandemic and the things that the action that we could take to maybe help that and make it better. For crisis communicators, an acute issue is that the challenge of finding information we can trust as information participants becomes compounded when we lose trust in official sources or the government agencies charged with managing the response. For those agencies right now, I really recommend that they be truthful, building their policies and recommendations using the best science available at the time, communicating the scientific uncertainty in ways that their audiences can understand, and being honest about their rationale for specific recommendations. And I know that this is going to be acute when we talk about masks coming up in the next few weeks. Otherwise, these agencies risk losing trust at a time when it's most critical for people to be able to find and act on trusted information. For political leaders and communicators, I recommend that they reflect on how their statements contribute to the spread of misinformation and may have detrimental effects on individual and collective responses. When elected leaders and political appointees share dubious information and contradict their own agencies and scientists, this foments distrust and diminishes our ability to find the information we need, increasing the anxiety and uncertainty, and even causing people to take actions that endanger themselves and others. On the technology side, I'm supportive of many of the actions taken by social media platforms for preventing the spread of misinformation. I want us to consider how these changes we may need to revisit these as the event kind of calms down, because we're making some pretty extreme changes. In particular, I commend the platforms for applying new policies, not just to everyday people, but to influencers, including high-profile media pundits and even elected leaders. We've seen them take actions that for the first time against political leaders in terms of removing their content. I think that's a good thing. However, I caution against the sort of fine-grained policing of content that might inadvertently silence the collective sense-making process that is so vital for people coping with the impacts of the pandemic. So I really encourage the platforms to continue to sort of focus on influence and how the dynamics of their platforms help misinformation and disinformation go viral, rather than focusing on the sense makers or the people that are just trying to cope with this event and may sometimes get it wrong, but that's actually an important part of our response to this kind of disaster events. And so I spoke too fast, so I think I'm going to end early, but hopefully we'll have some time for questions later. Thank you.
Great. Thank you very much, Kate. We're going to move next to my colleague, Renee DeResta, who ordinarily occupies an office just down the hall from me on Stanford University's campus, but not today. Today, Renee is going to talk to us from somewhere else, where hopefully her connection is going to be stable. She is a researcher at the Stanford Internet Observatory, and she's going to talk to us about misinformation and disinformation with respect to COVID-19. Renee, you can join with your screen and slides now if you can.
Title slide, Propaganda and Pandemics, How Chinese State Media Shapes Narratives on Coronavirus. So I'm actually not talking about social media misinformation and disinformation in the user-generated mimetic context in this case. One of the projects that we've been working on, my colleague Vanessa Molter has done a bunch of excellent research over the last month. We've been observing Chinese white propaganda for quite some time. We began actually in a project related to the Taiwan election, and we started following along with what the official channels were saying, what the English language channels specifically were saying, to understand how state-sponsored narratives were shaping the conversation worldwide. So as just a really quick background, the propaganda spectrum, when we talk about this is not a new concept. States work to control information for reasons of everything from public diplomacy to malign influence. When we talk about the propaganda spectrum, we start on the white propaganda spectrum, which means it's overtly attributable. You know exactly what state is producing the content. In these cases, China is most often in the name. Other examples would be Russia Today. Then there's the kind of gray propaganda spectrum. That's where you get into the provenance, the claims, the funding sources are obscured a bit. And then black propaganda is the deliberate misattribution, the sort of internet research agency or troll farm activity that we actually talk about quite a bit. But for this particular chat, what I want to go into is actually the white propaganda ecosystem and how narratives are moving their way from Chinese social media through to Chinese narrative propaganda and then being pushed out both on Facebook and through strategic communications on Twitter and elsewhere by high-profile attributable diplomats. So everything we're talking about here, there's no plausible deniability involved. This is a state-sponsored communication. So the interesting thing about China's white propaganda ecosystem is that it exists on Facebook, even though Facebook is banned in China. So what they've done is they've created a range of properties, and most of their properties are regionalized. So the ones that you're looking at on my screen right now are the ones that are in English specifically, but there are also Spanish language and Arabic language and a number of other regionalizations for most of these properties. But you can also see year-over-year growth. So this is 1 year's worth of data. And so you can see that these pages over in the page likes column are upwards of, many of them, most of them, upwards of 50 million likes. Just to put that in perspective, CNN has about 33 million likes. Fox News has, I think, around 14 or 15 million likes. So China is investing heavily in this English language broadcast ecosystem on Facebook. They're prioritizing the development of it, and they do have massive audiences, even though we believe the interaction rate, the engagement rate is not as high as you would see on other state media. So one of the ways that they've done the work of amassing this audience is they do run Facebook ads. And so we've observed over time, while most of the ads generally focus on positive news stories about China, beginning in January of this year, about a third to half of them began to focus almost exclusively on coronavirus. So China was paying to boost its state-sponsored propaganda stories on coronavirus in particular. So we started looking at why that was and what that was. And one of the things we believe is that perception of the pandemic has been a significant PR challenge. And this is because, of course, there is a sense that, the virus originated in China. And so that the Chinese response was a bit slow, that the Chinese response initially was to conceal, that the data emerging was not necessarily reliable. There was a news story that broke today claiming that the death numbers have been vastly underreported. And so there was a lot of need to manage perceptions, need to manage the way that the world saw their response to the outbreak. And also, as they got a handle on their regional outbreak, as it gradually became a pandemic, ways in which that narrative was then ported into broader narratives around how the Chinese government system was superior to Western democracies because it had allowed them to tamp down in extremely effective ways. So Chinese media began covering the coronavirus and very early, of course, in January 2020. This is where we began to see state-sponsored media, including coronavirus content in their posts. You can see there's a rather significant offset. The U.S. is about a month behind as we look at what, it was not a thing that most U.S. media was paying attention to quite the same extent. So a lot of the conversation that we're looking at began much earlier in China as the significance became much clearer in China first. We observed three primary narratives. There's content related to the origin, there's content related to the spread and treatment, and then there's content related to the government response. A fourth narrative has begun to emerge that's related to conspiratorial state communications, which I'll touch on very, very briefly because I've only got 7 minutes. But narrative one, the media spin was really focused on rapid recovery. So you see here two kind of conflicting stories about a baby diagnosed with coronavirus. So the CNN emphasis is on the diagnosis. The China Daily story is actually on the fact that here was this other baby that was born with no infection. So China is putting out very positive news stories in its official channels about cures, about rapid recovery, about the number of people who have been successfully treated, while US focus is much more on numbers of infections. The Li Wenling case, this was, of course, the doctor who was the whistleblower. There is no mention in the official communications or reports that are put out in the English language media ecosystem of the early warnings, the fact that he was arrested, the silencing attempts. What we see instead is we're mourning a national hero. So a lot of the content on that focus, the warning piece of it is largely left out of the narrative. Instead, we have the narrative of a hero doctor who was one of the first to uncover the virus and the early activity that the Chinese state government, the kind of persecution is possibly a bit strong, but the arrest and the silencing attempts were largely eliminated from the narrative. We see again, what are the words, we're examining words that they use.
1 minute.
And we're beginning to see, again, the narratives really focusing very much on him and his personal story, not China's reaction to it. China then begins to frame the response narrative as China has bought the world time. Their effective containment, their effective treatment has given the world time to prepare because the pandemic was not universal earlier, versus the US, which of course is focusing on the way in which China has in fact botched their response. These platforms are really being used as a tool in shaping the global narrative. There's quite a PR battle happening. This is where you begin to see the conspiratorial communications emerging. Conspiratorial communications began in their media ecosystem in early January, but really made national news in March. So it was about a 2-month kind of percolation through channels to get conspiratorial narratives saying that the outbreak didn't originate in China out there earlier. I'll just say that io.stanford.edu is where our blog posts and research are posted, and you can see much more in detail and methodology around the work that we've been doing on this.
Great. Thanks very much, Renee. I'm going to repeat that web address for everyone. That's io for Internet Observatory.stanford.edu, where you can get more information about Renee DiResta's research as well as other scholars too. Before moving to our third presentation, I just want to remind the audience watching that you're welcome to pose questions for any of the panelists by going to the live stream website, hai.stanford.edu, and click the Submit the Question button. And I'd now like to introduce our third speaker, who is Megan Palmer. Megan Palmer has a brand new job, I'm told, just as of today, the Executive Director of Initiatives in Bioleadership at Stanford University. And she's going to talk to us about COVID-19 and broader issues in biosecurity. Megan.
Wonderful. Thanks for having me today. For the last 4.5 years, I've been a senior research scholar at the Center for International Security and Cooperation at Stanford University. I lead an interdisciplinary group that studies how individuals and organizations contend with the responsible development of biotechnology, with a focus on how security is conceived of and managed. And as Rob mentioned, today is actually my first day in a new role at Stanford as Executive Director of Initiatives on Bioleadership, an effort spearheaded by bioengineering, but designed to connect with efforts across and beyond the university to both explore how biological science and engineering are shaping our societies and to guide innovation to serve public interests. This effort is driven by recognition of the increasingly important role that biotechnology plays in our societies, including safeguarding against biological threats. Less than a month ago, I was testifying in the US Senate about the need for strategies to prevent and prepare for future biological threats, as otherwise COVID-19 will not be the last and likely not the worst pandemic. Biosecurity is a very broad area, but today I wanted to touch on 2 topics where COVID-19 is shedding light on long-term strategic issues. The first is how we prioritize and manage biological threats in an evolving international security landscape. And related to this, how do we deal with technologies that can both mitigate and cause security threats? That is, they are dual use, including technologies at the intersection of biotechnology and AI. So first, the evolving security landscape. Experts have long warned about the seriousness of biological threats, and in spite of this, these threats often receive low and inconsistent attention relative to other security areas such as nuclear risks. The US and other nations have biodefense strategies, but we're seeing the ways in which these strategies can fail in both design and implementation, especially coordinating across nations. One issue I want to highlight today is the underlying challenge of estimating the scale of these threats. There are several different origins for biological threats. First, there are naturally emerging infectious diseases for which we have the most experience and data. This pandemic is in many ways the least surprising set of events, and yet even experts calling to take these issues seriously often underestimated the consequences. Secondly, there's the possibility of accidents from labs that are studying pandemic pathogens. And third, there is intentional misuse, including the possibility of weapons development by state or non-state groups. For these last 2 categories, our threat estimates are highly uncertain, and experts disagree both on the scale of the risk and the likely effectiveness of risk mitigation strategies. The events of this year will undoubtedly change risk perceptions and how we prioritize these different types of threats as a result. And there is a question on how that risk calculus should change. These events will also change how we think about consequences, including knock-on effects and intersections with other security domains, like information security, that create compounding vulnerabilities, as my fellow panelists are highlighting today. Some of the work my group has done involves looking at different estimates and conceptions of risk and how they do and might inform our threat prioritization, especially in the midst of great uncertainty. We also have developed scenarios of different security threats to study how we might avoid over-indexing on any particular type of threat, blinding us to future possibilities. There can be future pandemics, natural, accidental, or intentional in origin, that may dwarf or look very different than the current outbreak. Which brings me to my second related topic. How do we manage technologies that can be used for good or for ill, that is, they are dual use? For good, we are now relying upon innovations in biological science and engineering to deliver the diagnostics, therapies, and vaccines we need to respond to pandemics. As we'll hear later today, AI and information sciences more broadly are a critical part of that tool set. For bad, we see the devastating impacts that infectious disease can have on our society. How do we safeguard against accidentally releasing or intentionally creating organisms that could cause just as, or potentially even more devastating consequences? And this dual use nature applies not only to biotech. How do we ensure that the surveillance tools we develop to help prevent the spread of disease don't create longer-term vulnerabilities that suppress civil liberties after this pandemic is over? I think it might be helpful to share one example of a conundrum in dual use management that has been a focus for my group. Advances in biotechnology are enabling research groups around the world to synthesize novel viruses in the lab without relying on the physical delivery of samples from patients. For example, in February, Swiss scientists created a synthetic genomics platform for reconstruction of the SARS-CoV-2 virus and published their methods in an open preprint server bioarchive. Broad access to these methods can enable the rapid development of diagnostics, therapies, and vaccines that we need to respond to emergent threats. However, as methods and tools spread across the world, we also must wonder at what stage they can generate new types of risks and how those should be managed. This is not a purely hypothetical concern. In past outbreaks, such as the SARS response in the early 2000s, we saw cases also of laboratory-acquired infections. And moreover, we know that the same types of processes that can enable reconstruction of viruses for groups working to end this crisis could very well be used by others attempting to manufacture this or other viruses for ill purposes. So one of the things my group looks at is how we decide when and how research contributes to security rather than undermines it, as a function of both the conditions in our research settings and changes in the global threat landscape. It's worth noting that in the US, labs doing certain research on novel coronaviruses experienced a temporary federal funding freeze in 2014 as a result of oversight bodies being concerned about the risk this might generate. And the resulting policies that were enacted around the care and oversight of potential pandemic pathogens designed to manage research-related risks are actually undergoing assessment and revisions. And this assessment will certainly be influenced by the latest events.
1 minute.
I won't have time to go into it today, but our group combines different methods and fields, including risk analysis, social psychology, and policy assessment to examine the underlying assumptions in these policy and oversight designs, and also examine the organizational and governance strategies that might be used to adapt those policies in response to new information. So just to conclude, COVID-19 will certainly change how we think about biological threats and how they should be managed, including how we manage the innovations in science and technology that can both mitigate and cause wide societal harms. The stakes are high, and we need more work to understand how we respond and manage risks in the midst of great uncertainty in ways that are closely coupled to those on the ground, making real-time decisions and informed by a variety of different disciplines. Thanks very much for having me join you today.
Thank you very much, Megan. So for our final panelist, we're going to now move to Iram Alam, who is a professor at Harvard University, where she teaches in the history of medicine. So we've gone from information and misinformation and infodemic to broader issues in biosecurity, and now someone whose chief scholarly focus is on the history of medicine for a look at how COVID-19 is interacting with longstanding issues of xenophobia.
you so much to organizers for all of their efforts in putting this together so quickly and for inviting me to contribute a few thoughts and preliminary observations on this present pandemic. So my talk is called Foreign Bodies, COVID and Xenophobia, and I'm interested in exploring how the virus as a vector of disease that is foreign to the body gets collapsed and equated with bodies that are considered foreign to an imagination of the nation. So here I'm really thinking about the terms that I'm sure we've heard, Chinese virus, Kung flu, Wuhan virus, foreign virus. So this rhetorical slippage that happens has significant consequences, I argue. And the most obvious is in the increase in hate crimes and racist incidents against the East Asian American community over the course of the last few months. So as a historian, I am going to provide a slightly different perspective on this question. And what I am attentive to are the logics and the discursive frames that are really marshaled in these acts of naming and of violence and of excavating the residues from the past that help to explain this present phenomena. So in the very brief time that I have, I'd like to highlight two historical threads that I think have really come together to activate and embolden xenophobia in relation to COVID-19. So I teach a course on the history of medicine and health in America. And on the first day of class, which was January 27, 2020, I showed my students the following set of political cartoons. So the first is from May 1882 and depicts San Francisco, close to where many of you are at the moment. And emanating from the boats in this image and from a congested residential space are three spectral figures with the words malaria, smallpox, and leprosy written on their garments. And the figure on the far right is sending some kind of vaporous discharge or maintaining some sort of miasmatic link with the region labeled Chinatown. So just a few weeks prior to the publication of this image, the US Congress passed the Chinese Exclusion Act. This bill was the first piece of immigration legislation that prohibited the entry of Chinese laborers into the United States and also prevented Chinese people who were already in the United States from becoming US citizens. So the passage of this piece of legislation was heavily motivated by the fear of a contaminated Chinese body shedding contagion everywhere, coupled with this economic anxiety about Chinese laborers stealing US jobs. And through this act, I think an antagonistic relation to something, some figuration of what something of Chinese was codified into US law. So the second image that we studied was this one from January 23rd, 2020. And in this illustration, there are shipping boxes labeled with the Corona Wuhan virus and a reaper figure on the left saying or thinking, quote, a Chinese export with a tariff you don't want to pay. So in this depiction, the spread of viral contagion is refracted through Trump's trade war with China, once again emphasizing the entanglement between biological and economic logics. So taken together, these two representations, spaced 138 years apart, do reinforce the idea that an adversarial and paranoid relation to the Chinese body is required to prevent US biological and economic death. And in this project of preserving US life versus Chinese death, every US citizen is always already conscripted, which is my second point. So many scholars have provided an in-depth analysis of this state of permanent war and total war that was inaugurated after World War II and reconfigured and expanded during the War on Terror. So in this new regime, war is no longer an event that occurs on a battlefield between two sides, friend, enemy, bounded by time and space. Instead, it's a permanent state of militarization that enrolls a civilian population in the continual project of risk assessment and mitigation exemplified in the statement, "If you see something, say something," that I'm sure we're all familiar with after the War on Terror. So in this injunction, identifying and naming an enemy, which is often conjured using some combination of history, fantasy, and anxiety, is followed by this rapid commandment to act, justified by the moral imperative of security. So what total war does is it condenses this reaction time, and delay is a disaster. And in return for this participation and vigilance, there's this promise of total security and total control, and a closed and impervious body politic. So our present moment is a little bit tricky in relation to this concept. So when the metaphor of war is explicitly activated against a disease, hospitals become battlefields, care workers are on the front lines, and every patient is a possible warrior, the civilian come patient is called to stand at attention and urgently search for an enemy. But a viral threat poses a peculiar kind of challenge for this total war apparatus. So each body has the potential to host a virus, but also to be held hostage by this foreign vector. So the vigilant citizen who's enrolled to surveil the threat can morph into the asymptomatic weapon of mass destruction through a simple doorknob. They can become the very terror that they're enlisted to police, turning into the most intimate kind of enemy and carrying the foreigner within. So this risk becomes omnipresent and uncontainable. And so what we're seeing is an externalization of this unknowability and anxiety into familiar racialized tropes in ways similar to what happened after 9/11. With COVID, though, it's the resurrection of the script which has framed Chinese bodies as diseased and a plague on American life for over a century. And I've been thinking about the language of security and vigilance, which is tied to social distance at this time. And I wonder how conceptions of the social are actually being defined and redefined in this moment, and urge us to think about who gets included in this idea of the social. Thank you.
Thank you very much, Professor Allen. So I'd like to ask all of our panelists now to rejoin us. You can unmute yourselves and rejoin us on audio. And my co-host, Rust, as well. I'm going to toss it over to you for the first question for the panel.
Great, and I see everybody. Thank you very much for your really stimulating comments. So as you know, this conference in part is about AI and its impact on this pandemic, either anticipated or unanticipated. And I'm wondering, for whoever would like to answer this, in each of your areas of scholarly work, is there interest in the field or action in using AI technologies? So for example, Kate, for tracking the infodemic or tracking what the collective sense-making is. For Renee, for tracking this white to gray to darker government data sources. For Megan, the biosecurity risk tracking, and for Iram, the historical analysis community. I'm sure you're all trying to manage tons of data. Is AI there yet, or is it mostly still a promise? And who would like to go? We can go in the order of our speakers, so maybe Kate first.
Sure. So I guess let's think about it in two different ways. As a researcher, is AI there? There are machine learning tools that we would call artificial intelligence that we use as part of our research. It's one tool among many others. We use visualization. We use a lot of human-powered things as well. But we definitely have natural language processing type things in our research repertoire. In terms of real-time addressing misinformation and the infodemic or whatever we might want to call it, I mean, when we think about what the platforms are doing, certainly they are at least talking about using AI, and AI is a part of what they use to find misinformation and figure out what they need to address, although it's imperfect and still needs humans in the loop to have it work well.
Renee?
Yeah, I would echo everything Kate said. We use similar technologies for our research, particularly into social media, social networks. I would say on the propaganda front, the issue is really much more of a policy one at this point. It's not that we don't know it's there. It's not that we can't see where it's coming from. It's really more a matter of how do we think about how far it spreads, how much automatic lift it gets, and what the appropriate response is. recognizing it is disclosed. So it really becomes much more of a question of national values informing the public. Excuse me, it's just much more of a social issue at this point.
Thanks. Megan?
I'd say machine learning and AI is increasingly an important part of the tool set being used in biological sciences and the discoveries that we need to sort through vast amounts of genomic and other types of data. So that's certainly part of it. And then we also see its use in areas like attribution that are an important facet of biosecurity in an uncertain landscape. And so certainly already there, and we're seeing it increasingly part of an integrated tool set.
Thanks. And Iram?
And within, the digital humanities, I think this really provides a great platform for amassing huge amounts of data to be able to look at change over time in ways that are unprecedented. Access to digital records and archives, I think, provide openings that just were not possible for one person to be able to access and to use previously. So it's enriched the kind of work that we do and the scope that we can do, certainly.
Thank you.
Good. Let me now direct a question, I guess, chiefly to Renee and Kate, and then I'll have a second one for Megan and Iram in just a second. But you both, Renee and Kate, have been studying the platforms as well as the way that information circulates on platforms for a long time. Both of you, if I caught the words correctly in your presentations, said that many of the platforms have, in certain respects, risen to the challenge of the pandemic and begun to either foreground authoritative information in a way that they never had before, or to really make vigorous efforts in a way they hadn't before to downrank or eliminate false information, conspiracy theories, etc. I wondered, can you, first, is that an accurate assessment in your view that the platforms have performed better in the face of this particular controversy than in the past? And then second, what do you think that augurs for the future? Do you predict better judgment, better performance of the platforms in the face of standing misinformation and disinformation? I'll go with Kate first.
Oh, that's okay. It's a hard question. I would say they've taken stronger actions than they've been willing to take around misinformation in the political context, for instance. And I think there's something about crisis events where we as a public may be more willing to accept heavier-handed policies around misinformation than we would be in the political context. And so their policies are more content-based than behavior-based than we're used to. They've added content-based things. And so there are things there that I think are going to be more effective against misinformation, but also will begin, if they get extended past this context. And even in this context, there are some worries that that they might be stifling some kinds of contestations that, especially when they privilege authoritative voices. In some contexts, that sounds great. In other contexts, well, that doesn't sound so great. And so I've been critical of similar policies in the China context, and now here we're seeing them in the U.S. and we're in some cases celebrating. So as a researcher, it's a tense moment. I really think we need to have a period of reckoning about the changes that they've made and see if there are things that we want them to extend, or if they demand sort of new criticism as the crisis resolves.
Yeah, Renee.
So I'll say two things. One, a lot of the policies stem actually from policies undertaken in response to the measles outbreaks of last year. And I had some conversations about those as the policies were being formed, because at that point, one of the interesting things is that the science was really quite settled with measles. There was not a debate about this. Was not a new disease that no one had ever seen before. There were extremely high death tolls in misinformation-dense environments like Samoa. Over 70 children died. So there was a clear, demonstrable impact that the anti-vaccine movement was having on these outbreaks. And so we did begin to think about how do we surface and downrank, so surface authoritative, downrank the grifters, the conspiracy theorists, and the anti-vaccine groups. And there was a balance that was struck. We allow them to exist. They continue to exist on the platform, but they're de-emphasized. The platform removed them from their recommendation engine and de-emphasized their conspiratorial content. And in return, what it did, the other side of that was that it did amplify the CDC and the WHO as authoritative sources for information about that outbreak. Now, this has become a bit of a controversy now because, as we discussed in the last, as your speakers in the last session raised, the CDC and the WHO are operating with incomplete information at the moment. This is a new disease. This is something nobody's seen before. As Kate raised in her presentation also, what that's translated to is poor communication from the institutional authorities. And so the question now is, how do we think about that balance between the recognition that occasionally established authorities or institutional authorities will get things wrong? And how do you ensure that your marker for authoritativeness is not institutional credentialism, but that there is an opportunity for authoritative voices who are still medical experts, who are still scientific experts, or who are still, talented emerging researchers? So how do you continue to minimize the grift and the conspiracy while at the same time recognizing that you don't want to over-index on institutional authority?
Yeah, great. Thanks a lot. That's really interesting, because I think all of us here in the United States and elsewhere have been wondering about the performance of the large platforms when it comes to election issues, and now we see a different kind of response, and all the questions of authoritative voices ever present. So thanks for those reflections. Megan and Iram, I want to direct the next question at you primarily, picking up a thread also from the earlier session we had today, in which various of the speakers indicated that for the data to be good, either to build models on which to predict the path of the pandemic, or to install various ways of monitoring at scale, that we need surveillance technologies in order to secure ourselves from these biopandemics. Megan, that was one of the things you mentioned in your presentation. And then when I hear that and I pair that with an historical account of the actual response through surveillance, that's not just general across the entire population, but disproportionate and targeted perhaps in certain ways, and not always just for the purpose of biosecurity. Megan, I wonder if you can reflect upon how you would respond to the historian who says surveillance doesn't always work out just for biosecurity's benefit. And Iram, I wonder if you could reflect upon Megan's challenge, which is for better security against the very ravages of the pandemic, surveillance technologies might be necessary or are indeed necessary. So Megan, can I start with you?
Yeah, I'll admit, I think this is a really difficult challenge, and one that spans all the way from policies to the details of implementation, and asking questions of what we're willing to trade off for the public good in moments of crisis, and how we keep an eye on the long-term effects this has. It's very difficult to do that, and so we need to make sure that we're building the infrastructure early that can carefully manage the trade-offs between information sharing, protection of privacy, and whatnot. I'd say that we're certainly not asking the right set of questions all the time when we're in a moment of crisis. And so I see many of my colleagues also struggling with how we build the types of platforms in real time to do effective collection and sharing of data. And the ones that have been often the most effective are the ones that were built in advance. So we mentioned, even NextStrain as an example of a platform built in advance that could be leveraged. In other cases, we're seeing data cropping up in multiple different platforms, and you run into the same questions of what to trust.
Yeah. Thanks, Megan. Iram, would you like to get in the conversation too?
Sure. Yeah, I guess my thought is just that I think we always have to remember that surveillance or any kind of technology is a social technology, that it's not divorced from the ways that it's implemented, and that the use of it is always going to have a relation to actual material consequences. And so I guess just keeping an eye to that, as not giving it the status of just a scientific universal good, but kind of inserting a question into what that is I think the challenge. And the limit of how much and when and where, I think that is a very difficult question. It's a question of saying whose life, when, how many, which is once again a very, very difficult question. But I also think we need to recognize that a lot of the infrastructure that we built around this question of the pandemic has some kind of vision of a nationalistic border, and that is a difficult thing to actually think about in this age of globalization and the permeability of all of us to everything. So, to really keep that, I think, in mind as we do build these kinds of models, that there are many, many downstream impacts in other countries that are related to the actions that are taken by the US and the UK.
Yeah, thank you for that. Now, a question from the audience that's come in that I think gives Kate, Renee, and Megan perhaps a chance for an exchange. Of course, Aram, get into the conversation too if you wish. Several people from the audience have written in to ask what to make of conspiracy theories that allege that COVID-19 was birthed in a bioweapons laboratory or a research lab and then deliberately unleashed upon the world. What does that mean for your world, Megan, of biosecurity, that such conspiracy theories are out and about? And Renee and Kate, what do you make of conspiracy theories as such in these particular moments?
So I think this speaks to both how difficult it is to combat conspiracy theories, and the reason I'm grateful for a fellow panelist today, and the difficulty of forming an evidence base in the midst of uncertainty, right? We have high-profile publications that essentially argue that we have no evidence base to assume that this came from a bioweapons lab or is engineered. But at the same time, we will continue to persist in any type of outbreak or pandemic with uncertainty over the exact origins, right? Where patient zero is. And so that's a challenge of how we communicate uncertainty and the continued collection of data to get and refine our understanding of the origins, while also combating these conspiracy theories that are politically motivated, right? And have different political ends. And so, what we can do as a research community is, I think, continue to point to the lines of evidence that combat against these conspiracy theories, and but at the same time refine our communications that we need to get better at building the evidence base in the midst of crisis on exactly where risks originate now and where they might originate in the future.
Mm-hmm. Renee?
We did a trace of the conspiracy narrative, the Chinese version of the bioweapon narrative, which says that during the world, I believe it's the World Military Games is perhaps the name of it, U.S. representatives were in China, in Wuhan. There was a cyclist. He was stationed at a fort. The fort did bio research. Ergo, of course, he brought the virus over. That's the rough sketch, and you can follow through the timeline of how that made it from the kind of underbelly. A lot of the conspiracies are often bottom up. The bioweapons one is absolutely, it pops up every time there's an outbreak. Russia used it as a narrative during the AIDS crisis, actually, as KGB propaganda. The idea that the CIA had created AIDS, that AIDS was a bioweapon that had gotten loose. They changed the variants according to what would make the most sense in the region. You see Iran talking about the virus as a bioweapon in this particular case, saying that it is actually tailored to the genome of the Iranian people. You see RT amplifying the Iranian state conspiracy, because there's a difference between the kind of bottom-up conspiratorial communities versus when you see conspiracy as statecraft. I call it tinfoil diplomacy, but it's just the idea that they are that actually the conspiracy becomes part of the public diplomacy communication. And one of the reasons they do it is to create a distraction. It also it removes responsibility from the leader if it's something that's been done to them by the outside, and so it creates an attitude to distance official responsibility, official failings, if this was something that was done to the state by someone else.
Mm-hmm. Kate, anything to add?
Yeah, there's not much more to add. Just as a researcher, misinformation, disinformation, and conspiracy theories, it just didn't surprise me at all. I mean, it's just like, of course that's going to happen. Oh, and everybody's going to point fingers at someone else for exactly the reasons Renee is spelling out there. It's not surprising. It's part of the, information space, and seems to be a tactic that must be working at some level because it keeps showing up in event after event after event.
If I could do an add-on to that, Rob,
Yeah,
and maybe specifically to Kate. Kate, in your comments, you mentioned that the social platforms have, in a somewhat impressive way, intervened and are trying to do filtering. Do you know the degree to which they are in concert with one another and trying to share best practices, or is this each social media platform kind of doing their own thing and hoping that the net effect is positive? I can see arguments in both directions. I'm wondering what the facts are if you know them.
So we might have to ask Renee here. I would say I don't know them right now. Over the last couple of years, we have seen them try to figure out ways they can collaborate on misinformation, disinformation without sort of violating privacy kinds of things and commitments that they have to their different users. And so they are still working on what that means. I can see the policies building off of each other, but I don't know exactly what's going on behind the scenes right now for the tech companies.
Erin, there's a question from the audience for you, which has to do with whether or not you have a view about the very different reaction in the United States, in particular, to the fact that suspicions of Asian Americans who might have brought the coronavirus with them from Asia to the United States are quite different than Europeans who might have traveled to the United States and also brought the coronavirus with them. Do you see evidence of xenophobia in the very different reactions there? One of the questioners wants to know.
Yeah, and I hope that my talk and in showing kind of the imagery from the 1870s was to show that there is continuity in the construction of the diseased Chinese body, and this is something that has been activated and reactivated over and over again. The Chinese person in relation to their diet and this kind of foreignness is also a very, very common trope that was used in the times of 1870s, 1880s, 1890s, and continues to be used today. So there are figures that we see through history, especially in the United States, that are kind of given this forever foreign status, and irrespective of the time in this country or generationally, there's always this distance that will remain with that group. And I guess that's just they're not able to assimilate within this fold in a way that the European body is able to do that. And so the foreignness of the virus gets overwritten by the foreignness of the body, and these two things feed off of each other in this kind of loop to condense and collapse a viral body into a foreign body.
One of the things which I'm curious to ask anyone on the panel about has to do with the various ways in which any of the things you've presented might be discussed either with parents to their children, perhaps with teachers to their elementary, middle school, high school age children. There's a bunch of questions that ask something in the neighborhood of the following. In an age in which there's rising distrust of authorities in general, and even in this moment, conspiracy theories and Zoom bombing, all kind of terrible behavior in the face of a global emergency. What kind of advice would you give to a parent trying to help steer their children through the information universe that's before them, or a teacher and to their students? And I mean, for an ordinary parent with a teenager, it's of course, Instagram or TikTok that is a chief source of information at the moment. And I wonder if, in the light of history or in the light of any of the research that you've done in the contemporary moment, you have advice to give to parents or teachers as they confront talking to children about how to think about what's going on. Kate?
It's a hard question for me because I've spent a lot of time the opposite type situation is explaining to teenagers and young people for them to teach their parents to do the right thing, because this is not a problem that just affects young people in terms of figuring out what to trust and how to make sense of information. And in fact, we talk about it as a K through 99 problem, is that we're all sort of struggling with these information spaces in different ways. And I don't know much about the sort of psychological needs of children in crisis events. That's not my area of expertise. And certainly there are a lot of impacts that are happening there that are just, I guess, beyond my expertise to talk about. in terms of the online engagement, again, it's like, less of it right now is probably better. And to focus on watching your local news once a day and maybe doing a little national news, but not to sit there on social media all day. And yet it's so hard to say that to a young person who that's the only way they have to connect with the world right now. And so I would just say to have those conversations and have them to be two-way conversations as well, because I think the young people have a lot to teach their parents.
Yeah. Iram, Megan, or Renee, any last words before we wrap up this session?
I might just so part of the work that my group does is actually understand the psychology of risk, how we conceive of risks over time, and work a lot with biological scientists and engineers and others on to what effect they take risks seriously. And so what we're seeing is that there wasn't a lot of overlap between the groups that studied biology and the folks that studied international security in the past. And I think we're going to see more and more those coming together as we realize both the scale of the threats, but also, frankly, an inspirational note about seeing the scientific community really rally together to try to confront these types of risks. And so I think it's a question of contending with the scale of the risks that we need to manage, but also a hopeful, inspiring image of what we can do when we work together. That's not just a technology problem, but certainly a social problem.
Mm-hmm.
On being a social problem, I think also paying attention to the cyclical nature of these kinds of problems and really thinking through the kinds of social dynamics that produce and reproduce these, I think is also an important thing to keep in mind.
Renee, any final words? Or
no, I think it's I think one of the key challenges we have right now is how do we appropriately communicate to people where institutions got things wrong, but also contextualize that. That's really, I think, one of the areas that's I've been the rest of the conference looking to others for guidance on how we do that. It's one thing to point to overt conspiracies. It becomes really challenging when institutions are getting things wrong or slow to react and are not transparently communicating. We're seeing a lot of failure at a lot of levels at this point. So it's a significant challenge going forward.
Good. Well, I want to thank all of you for your time today. And as a way of drawing this entire session to a close, I think from my point of view, my training as a philosopher doesn't give me any of the social scientific expertise, the biomedical expertise, or the historical expertise you've seen. But philosophers are so often deeply rooted in the past and see the evolution of ideas over the time of centuries. And one of the things that's notable, thinking even philosophically about the coronavirus, is how societies have been changed profoundly in the wake of global pandemics, as well as global wars. And we're just at the beginning stages of understanding what both the possibilities of positive change might be in order to allow ourselves a more global interdependence as a way of confronting the challenge, or perhaps all kinds of destabilization and a reconfiguration of geopolitical power. And that's part of why we want to bring this multidisciplinary approach to thinking about the challenge of coronavirus to you today. So Kate, Renee, Megan, and Iram, thank you very much for your time. We're going to take another break before we move to our third session of the afternoon. And we'll be back with you in just a short amount of time and look forward to your questions then. Thanks very much for joining us, everyone. See you soon.